Imagine walking into the hospital expecting help, expecting to be taken care of, expecting to come out feeling better than when you walked in. That's what we all expect. And yet, every single year, thousands of seniors leave the hospital with something they didn't come in with: a new infection, a dangerous medication mix-up, sudden confusion, or complications that had nothing to do with the original reason they were admitted in the first place. Here's the good news. The vast majority of these outcomes are preventable. They're not random bad luck. They tend to follow a handful of predictable patterns. Patterns that, once you know them, you can actively guard against, whether it's for yourself, a spouse, a parent, or a friend. Today, I'm going to walk you through the 5 biggest hospital mistakes seniors make, and more importantly, the simple, practical steps you can take to protect yourself or someone you love before, during, and after a hospital stay. None of what I'm about to share is complicated. Most of it takes just a few minutes of preparation. But that preparation can be the difference between a smooth recovery and a serious setback. Let's get started. Let's start with a mistake that happens before a patient even reaches their hospital bed, sometimes within the first few minutes of being admitted. Mistake 1. Going to the hospital without a complete medication list. Why this happens. When someone is rushed to the hospital, especially in an emergency, medications are often the last thing on anyone's mind. Understandably so. The focus is on getting help quickly. But when a doctor doesn't have a complete, accurate picture of everything a patient is currently taking, it opens the door to serious, avoidable errors. Why medication errors happen. Hospital staff need to know every medication a patient takes in order to safely prescribe new ones. If a patient can't clearly communicate their full list, whether due to confusion, stress, or simply forgetting in the moment, doctors may unknowingly prescribe something that conflicts with what's already in the patient's system. Drug interactions. Many common medications interact with each other in ways that can be dangerous when combined. Blood thinners, for example, can interact with a wide range of other drugs, sometimes increasing bleeding risk substantially. A new medication prescribed without knowledge of an existing one can trigger reactions ranging from mild to serious, including dangerously low blood pressure, excessive sedation, or abnormal heart rhythms. Supplements doctors should know about. It's not just prescription medications that matter. Over-the-counter supplements, vitamins, and herbal products can also interact with hospital medications in ways many people don't expect. Something as seemingly harmless as fish oil, St. John's wort, or even high-dose vitamin E can affect blood clotting or interact with anesthesia. Doctors can only account for what they know about, so leaving supplements off the list, even because it seems unimportant, removes a piece of the safety puzzle. Why seniors are at higher risk. Older adults are, on average, prescribed more medications than younger patients, often managing multiple chronic conditions at once, a situation sometimes referred to as polypharmacy. More medications simply means more potential points of interaction, and aging bodies often process and clear medications differently than they did decades earlier, making the margin for error smaller. The fix: keep an updated medication list. This is one of the simplest, highest impact habits you can build. Keep a written list of every medication, dosage, and supplement you take, updated anytime something changes. Include the name of the prescribing doctor for each one, if possible. Store it in 2 places. Keep a copy on your phone. A simple note or photo works fine. And keep a printed copy in your wallet or purse. In an emergency, you may not be able to speak clearly, or someone else may need to answer for you. Having this information readily available, in both places, means the hospital team has what they need the moment you arrive, not an hour later after someone tracks down your pharmacy. Once someone is admitted and settled into a hospital bed, a second, quieter risk begins, one that has nothing to do with the reason they were admitted in the first place. Mistake 2. Staying in bed too long. Why this happens. It seems intuitive to rest as much as possible while recovering in a hospital. Patients are often tired, sometimes in pain, and hospital staff are busy, so extended bed rest can become the default rather than a deliberate medical decision. But for older adults especially, prolonged immobility carries risks that can be more serious than many people realize. Muscle loss starts quickly. Research has shown that older adults can lose a meaningful percentage of muscle strength after just a few days of bed rest, in some cases losing more muscle in a week of hospitalization than they might in years of normal aging. This muscle loss directly affects the ability to walk, balance, and eventually return home safely. Blood clots. Lying still for extended periods slows blood circulation, particularly in the legs, increasing the risk of blood clots forming, a condition known as deep vein thrombosis. If a clot travels to the lungs, it can cause a life-threatening pulmonary embolism. This is one of the more serious, and more preventable risks of prolonged bed rest. Pneumonia risk, staying flat for long periods, also makes it harder to fully expand the lungs, which can allow fluid to pool and create conditions where pneumonia is more likely to develop, particularly in patients who are already weakened by illness or recovering from surgery. Balance decline. Even a short hospital stay can lead to a noticeable decline in balance and coordination, increasing fall risk both in the hospital and after returning home. This is one of the most under-discussed consequences of extended immobility. A patient can be medically recovered from the original illness, yet leave the hospital significantly weaker and less steady than when they arrived. The fix. Importance of walking safely. Whenever a doctor confirms it's medically appropriate, getting up and moving, even slowly, even just to a chair or down the hallway with assistance, helps preserve muscle strength, circulation, and balance. This should always be done safely, with staff assistance if there's any fall risk. But the key is not defaulting to bed rest simply because it feels like the safer or more comfortable choice. Physical therapy. Many hospitals have physical therapists available, and requesting an evaluation, rather than waiting for one to be offered, can help ensure a patient starts appropriate movement and strengthening exercises as early as it's safe to do so. Ask when it's safe to move. The simplest thing a patient or family member can do is directly ask the care team, "When is it safe for me to start getting up and walking?" This single question can prompt a mobility plan that might not otherwise be discussed until later in the stay, when more strength has already been lost. The next mistake isn't physical at all. It happens in the conversations, or the lack of conversations, between patients and their care team. Mistake 3. Not asking questions. Why this happens. Hospitals move fast. Doctors are often managing many patients at once, and appointments with specialists can feel rushed. Many patients, especially older adults who grew up in an era of deferring entirely to doctors' authority, may feel hesitant to ask questions or push for more clarity, worried about seeming difficult or taking up too much time. Understanding diagnoses. It's essential to leave every conversation with a doctor genuinely understanding what condition is being treated, in plain language, not just nodding along to medical terminology that isn't fully clear. If something isn't understood, asking, "Can you explain that in a different way?" is completely reasonable, and something doctors are used to being asked. Tests. Before any test, it's worth asking what the test is for, what the results might mean, and what happens next, depending on the outcome. This helps patients and families mentally prepare and reduces confusion later. Procedures. For any procedure, understanding the purpose, the expected recovery, and any risks involved allows for genuinely informed decision-making, rather than simply agreeing because it was recommended. Side effects. New medications almost always come with potential side effects, and knowing what to watch for in advance can help a patient or caregiver recognize a problem early, rather than assuming a new symptom is unrelated. Treatment alternatives. It's always reasonable to ask whether there are alternative treatment options, and what the reasoning is behind the specific recommendation being made. Doctors generally welcome engaged, curious patients. It typically leads to better outcomes and fewer misunderstandings. Encourage family involvement. Having a trusted family member or friend present during important conversations with doctors can make a significant difference. A second set of ears often catches details that get missed in the moment, especially when a patient is tired, in pain, or anxious. Patient rights. Every patient has the right to understand their own care, to ask for a second opinion, and to be an active participant in decisions about their treatment. Knowing this, and being willing to use it, is one of the most protective tools a patient has. The next mistake is one that can affect a patient at any point during their stay, often without any obvious warning. Mistake 4. Hospital infections. Why this happens. Hospitals, by necessity, are places where sick patients, medical equipment, and a constant flow of staff and visitors all come into close contact. Despite rigorous protocols, hospital-acquired infections remain a genuine risk, and older adults, whose immune systems may respond more slowly, are often more vulnerable to complications if an infection does occur. Hand hygiene. One of the simplest, most effective infection prevention tools is also one of the most commonly overlooked: hand hygiene. Patients and family members should feel entirely comfortable asking any staff member, "Have you had a chance to wash your hands?" before they begin any hands-on care. This isn't rude. It's an accepted, encouraged practice in most hospitals today. Catheters. Urinary catheters are a common source of hospital-acquired infection, particularly when left in place longer than medically necessary. It's reasonable to ask daily whether a catheter is still needed, since removing it as soon as it's safe to do so meaningfully reduces infection risk. IV lines. Similarly, IV lines can become a source of infection if not properly maintained or if left in place beyond what's needed. Watching for redness, swelling, or tenderness around an IV site and reporting it promptly can catch a developing infection early. Respiratory infections. Hospitals can also be a setting where respiratory illnesses spread, particularly during cold and flu season. Deep breathing exercises, when recommended by a care team, and getting up and moving when possible, both help reduce the risk of pneumonia and other respiratory complications. Visitors spreading illness. It's important for visitors who are feeling unwell, even with something that seems mild, like a cold, to postpone their visit. A minor illness for a healthy visitor can pose a much more serious risk to a hospitalized senior with a weakened immune system. Vaccination. Staying current on recommended vaccinations, including flu and pneumonia vaccines, provides an additional layer of protection, both before a planned hospital stay and as an ongoing part of general health maintenance. Recognizing warning signs. Fever, increased redness or swelling at any wound or IV site, sudden confusion, or a general sense that something isn't right, should always be reported to the care team immediately, rather than waiting to see if it resolves on its own. The final mistake often happens right at the very end of a hospital stay, a moment that can feel like relief, but is actually one of the most critical points for preventing future problems. Mistake 5. Poor discharge planning. Why this happens. Discharge day is often rushed. Patients are eager to go home, hospitals are managing bed availability, and a lot of important information can be delivered quickly, verbally, right before a patient walks out the door, precisely the moment when they're least likely to fully absorb and remember it all. Medication confusion. Discharge often comes with new medications, changes to existing ones, or both. Without a clear written explanation of what to take, when, and why, it's very easy for mistakes to happen once a patient is back in the comfort and lack of supervision of home. Follow-up appointments. Missing a follow-up appointment or not fully understanding why it's necessary can allow a developing complication to go unnoticed until it becomes more serious. Home safety. A hospital stay can leave a patient temporarily weaker or less steady than before, and returning to a home that hasn't been adjusted for that, loose rugs, poor lighting, stairs without a handrail, significantly increases fall risk during the recovery period. Warning symptoms. Before leaving, patients and caregivers should have a clear, written list of specific symptoms that would warrant calling a doctor or returning to the hospital, rather than being left to guess what's normal recovery and what's a red flag. Rehabilitation. If physical therapy, occupational therapy, or home health services are recommended, following through promptly, rather than delaying, helps preserve the progress made during the hospital stay and reduces the risk of another hospitalization down the line. Written discharge instructions. Verbal instructions are easy to forget, especially amid the stress and excitement of finally going home. Always ask for written discharge instructions, and don't hesitate to ask the nurse or doctor to review them together before leaving, making sure every question is answered while help is still available. Caregiver involvement. Whenever possible, having a family member or caregiver present for discharge instructions provides a second layer of understanding and support, especially for tasks like medication management that will fall to them once at home. 5 things every senior should bring to the hospital. Before we wrap up, here's a quick, practical list. The things every senior or their family should have ready to bring to the hospital, whether for a planned procedure or an unexpected visit. Medication list. The updated list we talked about earlier, including dosages and supplements. ID and insurance information, to speed up the admissions process and avoid delays in care. Medical history. A brief written summary of major past surgeries, conditions, and allergies. Phone charger. Small, but genuinely important for staying in contact with family and accessing that medication list saved on your phone. Glasses and hearing aids, along with their cases, so a patient can fully understand and participate in conversations about their own care. A couple of additional items worth having ready: emergency contact information for a family member or friend, and an advance directive, if one exists, so the care team clearly understands a patient's wishes regarding their treatment. Let's bring it all together. To help protect yourself or someone you love during a hospital stay, keep an updated medication list and store it in 2 places. Stay active and mobile whenever it's medically appropriate, rather than defaulting to bed rest. Ask questions until you genuinely understand your diagnosis, tests, and treatment. Take simple, proactive steps to help reduce infection risk, and prepare carefully for discharge, with written instructions and a clear plan for what comes next. None of these steps require special training or medical knowledge, just awareness, a little preparation, and the confidence to speak up. If this video helped you, please share it with a parent, a grandparent, or a friend. One conversation today could genuinely help prevent a serious mistake tomorrow. And if you'd like more simple, practical health tips designed especially for adults over 60, consider subscribing so you don't miss the next one. Thank you for watching, and I'll see you in the next video.